I would like to share a few pieces of anatomical information that might help during the yoga practices. It's good to know those anatomical details. First point, let's start with the spine. The spine is made out of bones, out of cartilage discs, and out of soft tissue, which are the ligaments and muscles that support the spine. The vertebrae are the bones. Their main mass is the vertebral body in the front of the vertebra. Behind the vertebral body is the bony arch that surrounds the spinal cord. The joints behind the arch that connect the one vertebra to the next and make the spine mobile, and bike handle-like bony extensions where the muscles can attach to move the spine. The spine is the structure that holds up our trunk and posture in an optimal way, combining stability and mobility. In the following X-rays, you can see where the spine actually is located in the body, where we usually think the spine is in the back. Here is a side view X-ray of a normal weight 27-year-old woman. You can see the outline of the neck, front and back, and the lower lumbar spine. And here are the vertebral bodies that support the weight of the head and the trunk. You can see that they are better described as being in the center of the body rather than in the back. Now, here are two horizontal slices cut through the bodies of a woman in her 60s and a man in his 70s. They all are of normal weight. You can see the skin of the belly at the top and the skin of the back at the bottom. You can even see the belly button. The white figure in the center is the bony vertebra. In this case, it's the fourth lumbar. Again, the vertebral body and the discs that transmit our weight are not in the back. As you see here, they are dead center. You can see the arch, the joints, and the bike handles, they're transverse and spinal processes. The second topic is where and how do we breathe? We have an inhalation, we have an exhalation, and maybe we have a short pause after exhalation. That's usually when muscles relax the most. The inhalation is an active process where the ribs expand, the sternum goes up, and the diaphragm goes down. The exhalation is usually when we don't do anything, when we just sit on a chair or lay on bed, is a passive process that doesn't involve any muscle activity. It just happens by the elasticity of the lungs and the chest walls, and with the diaphragm relaxing, going upward. This is a picture of the diaphragm from below, looking up into the chest. And you can see at the border of the diaphragm, you can see the ribs. And at the top, there's a sternum. At the back is actually the lumbar spine. When the diaphragm in our chest moves down with inhalation, the belly gets pushed down and outwards. If we lie down face up, the belly expands up and forward. If we lie face down on our belly, the belly has no space to move forward. So the movement of the inhalation arches the lumbar spine and the base of the sacrum, where the arrows are, backwards, up. This flattens the lumbar spine or the lumbar curve. And similar in yoga poses where we bring the knees towards the belly, the breath movement rounds the lower back outwards. And that's the area or the region where most of the low back pain is located. And the breath movement pushes the content of the abdomen down into the pelvic floor. Similarly, in yoga poses, when we put the knees close to our chest, then the belly doesn't have much space to expand forward, which leads to a rounding of the lower back, right at the low back where it meets the sacrum, where most of the low back pain happens. So it happens in flattening of a curve and a stretch in that area. So the third point I want to make is that people ask, how do I know that I sit right? Or what is the right way of sitting? And I have a suggestion how to do that. So you're sitting on your sit bones, move around a little to find the position where it's the easiest for sitting straight and you have the least sense of tension in your back. And you visualize that the spine is the central axis in your body that supports the transmission of your weight from the head down all the way through the spine, into the sacrum, into the pelvis, and the sits bones down into the chair. And then you place one hand near the belly button and the other hand right behind that same height in your back. And then you go slightly forward and backward. Take a few deep breaths and try to feel the movement of the breath, not only in the front, but also touching the hand in your back. That's where the breath then touches the area where you're hurting. So the fourth topic I want to present is how movement combines with breathing. It depends whether we do the movement slow and gentle without any effort, or we do movements with effort. If we do it without effort, usually movements where we stretch, for example, one side of the body, brings the breath movement into that stretched part of the body. This happens, for example, when we do the cat pose. If we do that slowly and let breathing happen on its own, then with the stretch, inhalation moves into the back, into the area where we have the pain, right at the lumbar spine and the sacrum. It's different when we do movements where we put effort in, like lifting a weight, for example. Then these movements usually are easier when we do that with exhalation. When we do the yoga practice at home, you don't have to be perfect. You don't have to be as good as our yoga instructors. The main point of these exercises is actually to do something with the physical body that you are able to feel and to sense. So listening to the body is kind of the language here. We want to feel how movements feel in the body, which is different from thinking about it. So our main interest is here that you do the movements and sense into them, listen to the body, train that facility of being present in the body. Thank you.